Hello everyone, I am Neelanjana Maulik. I am the Secretary of the Alzheimer's and Related Disorders Society of India, Calcutta chapter. I am also in charge of the dementia care training nationally under this organization. I have been working for people with dementia and their family members past 26 years, initially in the USA, and later I have started the work in Kolkata. So today we will basically focus on what a person with dementia goes through when they show signs of behavioral issues and how to effectively communicate with them and approach them. We are expecting that we will learn few points about this topic. So number one is understanding the various difficult behaviors that we see in a person with dementia. Secondly, we will see what are the potential triggers for such behaviors to occur in a person with dementia. Thirdly, we will see the effective ways to manage the difficult behaviors. And lastly, what we would do is identify various strategies and options to manage these difficult behaviors. So these are the 4 learning outcomes for today's talk. Now let us start to know the different types of difficult behaviors that we see in a person with dementia. We will start with verbal and physical aggression, which is very commonly seen in people with dementia. This is basically where we see the person with dementia uses verbal as well as physical aggression, and it's an action of attacking without any provocation. Secondly, the one that we see is anxiety in a person with dementia. This is when a person with dementia will feel nervous, will feel fearful, will feel worried about the environment that he or she is in. The third difficult behavior that we see in a person with dementia is restlessness or pacing up and down inside a room or inside a closed space. And this is basically a behavior that is, it's the inability of the person to rest himself or herself as a result of that anxiety. What we also see in people with dementia is repetition. This is an act of restating something. It could be a physical action or it could be a verbal words. They keep on repeating it over and over again, and that's sometimes very difficult for caregivers to deal with. We also see wandering in people with dementia. This is also a very difficult as well as challenging behavior in a person with dementia, because a lot of times they not only travel aimlessly within their closed space, but they also leave their house and sometimes get lost. So we have lots of people throughout the year goes missing, and it's a huge issue when we deal with people with dementia. We also see sundowning as a difficult behavior. Sundowning is a state of confusion that occurs usually in the late afternoon, or sometimes it goes well into the night, when the person with dementia will be totally confused, disoriented, will be looking for their home sometimes, or sometimes they will look for their mother, their near and dear ones, and they will keep either pacing or try to leave the space that they are in at that point of time. We also see hallucinations and delusions in people with dementia. So hallucination is basically sensation that appear to be real to them, and but they basically they are created in the mind of the person with dementia. So examples would be seeing things that are not there, hearing voices that you or me are not hearing, experiencing body sensations like crawling on the skin, smelling odors that are not there. I remember a person with dementia in our center who would tell me that he is experiencing cockroaches on his body, which I could not see, but he could feel it. So these are the different hallucinations that we see in people with dementia. People with dementia will also experience delusions. So delusions are basically beliefs, false beliefs that conflict with reality of the person, and it involves the theme of being followed, being harassed, being cheated, or being poisoned. So you would a lot of times hear people with dementia saying that you are poisoning my food and I don't want to eat that food. So basically this is a delusional state that they go through, and it is very difficult to manage when their reality is such. So this is one very difficult behavior that the family caregivers have to deal with in a person with dementia. We also see sleep problems in people with dementia, and this basically refers to inability to fall asleep as well as remain asleep. And so you would have people with dementia experiencing daytime sleeplessness or sometimes fragmented sleep at night time. We also have apathy. So apathy basically is a loss of diminished motivation in at least 2 or 3 domains. So either it could be cognitive activity or it could be an emotional activity, and it impairs that person's daily activities. So they will lose interest in their daily activities. Last but not the least, we have depression, also seen in people with dementia, and that's something that caregivers have to deal with all the time. It may not be a typical sign of the usual symptoms that we see in depression in another person, but in a person with dementia, basically it's a mood disorder that we see, and it can affect the person's daily life, and it could be seen as a feeling of sadness or loss or anger sometimes. That's basically how it is expressed in people with dementia. Now what we will do is we will discuss the different reasons why these behaviors that I just discussed with you appear in a person with dementia. So what we can do is we can identify 3 reasons why these difficult behaviors occur in a person with dementia. Number 1 is the damage to the brain structure. We know that the dementia symptoms that occur in a person with dementia is because of certain diseases in the brain, and these diseases could be irreversible types, which could be Alzheimer's disease, vascular dementia, Lewy body dementia, and because of the brain damage due to this disease, the person has difficulty behaving in a certain manner. Number 2 is the environment in which the person or the person with dementia finds themselves. So it could be a physical environment, it could be the emotional environment, or it could be the social environment. And all these aspects should be considered when we try and analyze why a particular behavior is occurring in a person with dementia. Last but not the least, we have the interaction or the communication with which the person is living in that environment. So exchange of information by the caregivers, exchange of information by people outside the family. It could be either verbal communication, it could be in writing, or it could be using other sorts of mediums. Now we come to the second potential trigger, which is the environment that I talked about. And under environment, we have 3 different aspects: the physical aspect, the emotional aspect, and the social aspect. So under the physical aspect, we will have the physical environment. The aspects to consider are whether the environment is physically familiar to the person, whether there are enough signposting around the person, whether there are clear directions as to where the person is heading towards, whether the noise level is too loud, whether the light level is too bright or insufficient. In terms of physical unmet needs, we have poor vision or hearing. If that is a problem in a person with dementia, then that person will have difficulty through their behaviors. If they are tired, they're fatigued, then they will also show behavioral issues because they are unable to express themselves with words, and therefore it is through their behaviors that they are letting us know that they are uncomfortable in their environment. They could be hungry or they could be thirsty. They could also have bowel or bladder problem, and again, because of their inability to express their needs, they express it through their behaviors. Sometimes use of medications, whether it's underuse or overuse, can also cause behavioral issues. Acute infection in the body or pain in any part of the body could also lead to behavioral issues. So these are aspects to consider when we analyze why that person is behaving difficult. When it comes to the emotional aspects, we will have to make sure that the person is comfortable, the person's identity is respected and honored. We also have to understand that the person needs attachment or needs to be included in the environment. And a lot of times we do see people with dementia not being included in the decision making, in the day-to-day life, and hence we see difficult behaviors occurring in people with dementia. We also have the problem of occupation. Say for an example, the person was a doctor in his earlier life and is not respected at this point of time because of the disease condition, and the caregivers are not behaving with respect and with dignity, and hence we see a lot of behavioral issues, and that person's occupation, past occupation, is not kept in mind when the communication is happening. So these are the emotional aspects to consider and could lead to triggers. Then lastly is the social need, which is also the aspect that needs to be considered, which is the personality of the person, the life story of the person, the relationship that person has or had earlier on, or the routine that person earlier followed, and of course their interests, the likes and dislikes the person has. So all these aspects need to be considered before we understand why that person is behaving in a certain manner. So now we come to the last trigger, which is the communication aspect. And under communication, we have two different types of communication. One is verbal communication, one is non-verbal communication. Under verbal communication, we have to consider the aspects as to what words we are using, how we are phrasing our sentences when we talk to people with dementia. In terms of non-verbal communication, the aspects that we need to keep in mind are the body language that we are using when we are in front of the person with dementia. We also have to be considerate about the facial expressions that we have when we talk to the person with dementia, the gestures that we use when we talk to people with dementia. For example, when you are smiling, when you meet someone, that basically tells the person that you are friendly, you are open, and that gives you the sense of relief. And so when you are communicating with a person with dementia, you have to have those kind of facial expressions to make them feel comfortable in their environment. Friends, now we will see a small story that I will talk to you about, an old lady. And she lived with her son, Ramesh, and daughter-in-law, Shubha. Through this story, the message we want to convey is that since dementia is not well understood as a condition, there is a lot of stigma and misinformation surrounding it. Also, with no cure for the condition, people think that there is nothing much we can do to enrich the quality of life of the person. However, it must be understood that if we are as informed caregiver, provide opportunities for the person, there is so much we can do to offer in their lives. So the first picture shows you that one day at 8 a.m., Shobha notices that Amma has not eaten her breakfast. She rushes to Amma's room. Amma is sitting on her bed and looking out of the window. Shobha says, "Amma, you haven't had your bath. Come on now, get up and have your bath. Breakfast will get cold. Rukmini will have to clean the vessels after that. Ramesh and I have to leave by 8:30 a.m. It's already 8 a.m. so hurry up." 15 minutes later, Amma was still sitting on the bed. Shobha gets worried. Shobha says, "Amma, what's wrong with you? I can't be late today. I have to make an important presentation. Customers are coming from Japan. Come on, get up now. Are you not well? Hurry up with your bath and come for breakfast. Get up. Please, please. Should I bring you your breakfast here?" Amma doesn't get up. She holds her shoulder to make her pay attention. Amma turns around and looks angrily at Shobha, and as if Shobha is a stranger. Finally, Shobha drags Amma for her bath. Amma refuses to eat her breakfast. Shobha and Ramesh are able to leave office only at 9 a.m. Shobha, why is Amma behaving like this? Ramesh, why is she so angry with us? Shobha and Ramesh were worried. They took Amma to the doctor. Tests were conducted and the doctor spoke to Amma. He explains the problem to Shobha and Amma. Your mother has dementia, probably of the Alzheimer's type. The symptoms will get worse over the years. There is no cure, but medicines can reduce symptoms. Ramesh, what can we do to help her? Doctor, you must understand her difficulties. Change how we interact with her. After meeting the doctor, Shobha and Ramesh discusses how dementia may be affecting Amma. Shobha, I used to keep explaining things in details to Amma. I was always telling her to hurry. Maybe that confused her more. Ramesh, and I felt bad because she did not know who I was. I didn't know she had dementia. They decided to change the way they talk to her and understand her problems while helping her. Shobha now knows that Amma finds it difficult to understand things. Amma cannot plan a bath. Also, Amma is slower and needs more time for everything. So she keeps all the items ready. Shobha always faces Amma while talking to her. She talks calmly. She uses short and simple sentences. She asks Amma to do only one task at a time and does not ask unnecessary questions. Shobha does not give long explanation. She knows it will confuse Amma. Shobha walks into the bathroom with Amma and helps her if needed. While helping, Shobha speaks in small and simple sentences. Shobha also helps Amma with her bath. Shobha always lets Amma do as much as she can. She helps Amma whenever Amma looks confused or upset. After Amma finishes her bath, Shobha leads her to the dining room. Amma needs less help on some days and more help on others. The amount of help that Amma needs is increasing. Shobha and Ramesh are able to leave for work on time on most days now. Amma also looks more peaceful. Shobha says, I am so glad we are now understanding Amma's problem. I just made a few changes in the way I talk to her and now she looks much happier. Ramesh says she smiles now much more often. Yesterday she was singing an old Hindi film song. She sings so well. Shobha and Ramesh know that Amma's condition cannot be cured. Her problem will get worse. She will need more care. And Shobha says, I will talk to my boss today. I want to start working from home instead. Ramesh says, I think I should leave my job and work as an independent consultant. Then I can be home with Amma more often. Many people think they cannot do anything for people with dementia because there is no cure. But if we learn how to talk to patients and how to help them, the patient is happier and so is the family. If coming to the management aspect of behaviors in people with dementia, we must all remember that not all behaviors that we see in people with dementia need intervention, need to be managed, need to be controlled. Please do remember that only if the behaviors that you see in people with dementia puts the person or the caregiver that is caring for that person at risk, only then you may step forward and try to manage it. If there is no risk involved at all, then believe me, there is no need to bother and try and manage or control that behavior. But unfortunately, we actually try and manage each and every behavior that we see in a person with dementia. Number two is, if that behavior is reducing the quality of life of that person or the caregiver, it is only then that we will intervene. When coming to those behaviors that we need to manage, please do remember that we have to gather information before we start coming up with a care plan and put down the points how to manage those. So in terms of gathering the information, in terms of gathering what has happened when that behavior occurred, we have to find where that behavior has occurred, whether it was in the bedroom, whether it was in the kitchen or in the toilet. Secondly, what was happening at that time of the day? Was it too busy, or was that the atmosphere very quiet? Who was affected by that behavior? Was the caregiver affected by that behavior, or was the person with dementia affected by that behavior? And how exactly did the person behave, and how did people who were with the person respond to that behavior? Now, once we have gathered all the information, analyzed the information, now what we are basically going to do is to effectively manage the difficult behaviors. We will have to try the various approaches, the effective approaches to bring about a change in the quality of life of the caregiver as well as the person with dementia. So there are basically 3 approaches that we can try out. Number 1 is reality orientation, number 2 is validation therapy, and number 3 is reminiscence therapy. These are wonderful therapies that could be used while we manage a difficult behavior in a person with dementia. So coming to the number 1 approach, communication approach, which is the reality approach. This approach can only be used when the person is in their early stage of the disease, when the reality of the person is still there, the insight is clear, and it is through reality orientation, like putting in reminders, providing clear signs, introducing myself as a caregiver to that person, also giving my name, or putting the name out. These are important information that we need to use when we bring in the reality orientation. But please do remember that reality orientation only works in the early stage of the condition. If it agitates the person, then we will have to stop using reality orientation. The next approach that we can use is the validation therapy. Validation therapy is basically focusing on the feelings of the person rather than the words the person uses, acknowledging the expression of emotions that the person uses when the person is distressed or angry or sad. We have to provide a lot of verbal and physical reassurance to the person. We have to genuinely have an eye contact with the person while we communicate with the person. We have to use touch when it is appropriate. We have to mirror emotion. If the person is sad, we also have to, through our facial expressions, show the person that we acknowledge what that person is going through. We have to empathize rather than sympathize with that person. So we have to say that, yes, we understand that you are going through a difficult time. Now we shall discuss the last approach, which is the reminiscence approach, and this is again a beautiful therapy that could be used for people with dementia, because we know people with dementia has short-term memory loss, and their long-term memory is still very much there, but it of course changes as the disease progresses. But when their long-term memory is still there, they in fact would like to dwell on their past, and if we can use pictures, clues and stories from the past experiences and share with them, and time and time again, then we can see a huge change in the difficult behaviors in people with dementia. So reminiscence therapy is one approach that you definitely need to use to manage difficult behavior. Now what we will do is take up few scenarios and explain how we can deal with this difficult behavior. Number 1 that we will use is how to respond to angry outbursts in people with dementia. So when you see a person with dementia being angry, using verbal or non-verbal aggression, what you can do is, rather than being upset about it, you can take a break. So if the person is in a safe environment, you can just walk out of that place, give yourself and that person a moment, come back maybe a few minutes later when the person has cooled down. You can also shift their attention and distract them to an activity that they love doing. You can also try various relaxing activities like using music, massage, exercises, or sharing stories with the person that can relax that person. So these are various ways you can use these strategies to respond to angry outbursts in a person with dementia. And definitely do not forget to use your calm voice while you talk to the person with dementia when that person with dementia is angry. Now we will discuss how to best respond to hallucinations. The first thing that you need to do is stop arguing, basically telling that person that what that person is hearing or seeing is not true. So that's the first line of approach that you would do. Never argue when that person says that he or she is seeing things or hearing things. Always try to calm that person down. As I said, validation approach is something that you could use here first, because you would validate their feelings. So say, for example, if they say that, I am seeing people coming in through the door to attack me, rather than saying there's no one coming through the door to attack you, you have to validate the feeling. So you have to say that I can see that you are really upset. What is it that is upsetting you? So you validate their feelings first. Once you have done that, then you can distract them and make them engage in activities that are meaningful to that person. The other thing that we always face in people with dementia is that they sometimes look into the mirror and they cannot recognize themselves, and therefore they will think that there's somebody else looking at them and trying to hurt them. So our recommendations are that you cover mirrors in the houses if you have one, and if you see that particular behavior is occurring. So these are the different ways you could respond to people who are hallucinating. Now we shall discuss how to respond when we see wandering happening in a person with dementia. Now you see, wandering is a term that we use because we see the dementia person aimlessly going here and there. But if you really see that wandering activity is also in us, those who do not have brain damage. When we do not have a purpose in our life, when we do not have things to do in our lives, we do aimlessly wander sometimes. And that's exactly what happens to a person with dementia, because that person with dementia is not engaged meaningfully in something. They really, because of that brain damage, they don't know how to engage themselves. They don't know how to motivate themselves. They fail to do that because of the brain damage. And therefore, they look for things, and that is the reason why they wander around. And to respond effectively to that behavior, all we need to do is engage them meaningfully. If we have a set routine, a structure to their day, we will definitely not see this wandering activity. The last scenario that I will discuss is how to respond to memory problems. Now, memory problems is one of the most seen behavior in people with dementia. Because of their damage to the brain, they forget things, people, places, anything that is short term, and then as the disease progresses, the long term memory also goes away. Now this is a problem that the caregivers face all the time, and the best way to respond to this is sometimes to repeat what you have said over and over again, patiently, with a calm voice. You could also, if that is bothering you as a caregiver, then you could also use photos and reminders to show and acquaint the person to the reality of the situation. You should also be brief when you talk to the person. So if, say for example, you want the person to go and have lunch, rather than having a long sentence to say that, okay, it's 12 o'clock, let's go and have lunch, can you please get up from the bed? Saying so many sentences confuses the person, and the person tends to forget that information, all that information. So you need to be brief. So to start, all you need to say is, can you please get up from bed? That's the first thing that you do. So once the person is up from bed, you then orient that person to the next task. So these are different ways that you could use to respond to memory issues. So coming to revising the main points that we discussed today, number one that you have to remember is that because of the damage to the brain, the progressive nature of dementia, we see a lot of behavioral issues like verbal or physical aggression, anxiety, wandering, hallucination, delusions, sleep problems, memory issues in a person with dementia. So behavioral problems are because of the brain damage. It is also important to remember that besides the brain damage, we also have the issue of the environment that I discussed, and lastly, the communication, the interactions we have with a person with dementia can also cause difficult behavior. So these are the 3 points you need to remember. Number 2 is we always have to remember to maintain dignity and autonomy of the person with dementia, along with effective communication, meaningful environment, and consider the unmet needs of the person with dementia. Last point that you need to keep in mind is that it is important to adopt methods of intervention, effective interventions to address the behavioral issues through practical ways of reality orientation, validation therapy, and reminiscence therapy. So as I end my talk today, I would really like to thank you for listening to me. We discussed the behavioral issues in a person with dementia today and the various ways, approaches that you could use to bring in quality of life in the person with dementia and their caregivers. I hope it was helpful and will be helpful to you as you care for someone living with dementia and guide someone who is caring for someone with dementia. The topic for tomorrow's session is safety measures for people with dementia, and I hope that you will enjoy tomorrow's session too. Thank you so much.